Parks and Recreation is the answer to so many social issues that you have, from physical health to mental wellness.
Post-pandemic, we've seen a lot of kids really suffering from a lack of socialization.
People are becoming more anxious, a little bit more distressed, and trying to work their way through this.
The Hayward Area Recreation and Park District is a special district that was actually formed 80 years ago. It's our anniversary. We provide park services and recreation services for 308,000 residents that live across 114 square miles, City of Hayward, and 5 areas of unincorporated Alameda County.
The way kids interact and socialize is totally different. There's a lot more screen time. So for us, getting kids outside, getting into parks and participating and being active in activities really made sense. We like to say that we have something for everyone. We have preschool programming all the way to senior programming. We do fitness, sports, aquatics, summer camps, special needs programs, the arts and personal enrichment activities.
There's just a lot of stress in society today, whether it's fiscal, political, work-wise.
Our role is to support and serve the community residents, particularly those who are suffering. And so we have several department partners, including public health. So in describing the partnership between Hayward Area Recreation Park District, I have to say that it has been tantamount. And so that work really helps us to think of new ways for some of the providers to prescribe health and wellness and going outside to the air and to breathe. So there's a really strong connection to not just the traditional modalities to help you feel better. There's actually a prescription.
Recreation RX is part of a greater health equity initiative, and how it works is a client will see their healthcare provider at Tiburcio Vasquez Health Center and receive a recreation prescription. They may be at risk for heart disease, diabetes, or just a need to get outside to relieve anxiety. And so the healthcare provider really knows the benefit of our important services and gives them a prescription to take advantage of some of the amazing things we have to offer.
You can go to a doctor and you can get a prescription for medication. This is the same concept, except you go to a clinician at a health clinic and they look at you and maybe say, you know, you seem a little depressed, you seem a little overweight, you need some activities. And people don't know really where to find those activities. By a health clinic writing you a recreation prescription that gives you all the information you need to contact the Recreation and Park Department and then be able to go out and participate in programs that are scholarship for free is kind of this full circle answer to trying to get people referred into healthy activities.
This is a truly proven, low cost, low barrier, easy to implement if you just have willing partners, way that people can be connected to methods that actually help them live.
Hi, my name is Helene Singer and I am a volunteer. I am the receptionist. I volunteer mainly for the sociability. I worked until I was 72 years old. I had a purpose. And then all of a sudden, nothing. It just makes me feel that I'm viable again. The population is aging. In this particular area, we have a lot of seniors. Well, the baby boomers. There's a lot of us out there. And I think we're all in the same position. We need company. We need people to talk to. They're friendly and they're lonely, and you're a happy face. It makes me happy, and I made a whole new family.
It works. It shows a person, if they're visiting their provider, that you actually need this. I'm going to prescribe X, Y, and Z to help you. And sometimes we as humans need that nudge. It is a very wise way to spend public dollars and to leverage partnerships.
I'm an independent special district of the state of California, governed by 5 elected board members. Our policymakers come from the community. They're connected to the community. They know what the community wants. They're very active and engaged. And so that allows me to take their direction in policy and be able to put it on the ground and implement it.
All the way around, it's a win-win. People from every walk of life, every language, every culture can invest, and it really does. If people are looking for a place to start that doesn't require building a building, signing a contract, you can do something very simple and something beautiful and sustainable.
In terms of our rec prescriptions, we're really, supporting how important we think parks and recreation is to people's mental health and their well-being. We're really able to leverage the resources and the facilities that we have to be responsive to the community's needs.